Walter.
Thank you very much for being here. You know, I appreciate your statement and your optimistic outlook for the People First waiver, but I have to tell you that the families in my district and in Western New York in general are not as optimistic about it as you are. So I don't know if that is a function of a lack of communication with those families, or if it's a reality that it's not as rosy a picture as perhaps you're painting. But the People First waiver is a fundamental redesign of the service delivery and funding model for services and supports with people with disabilities. What is OPWDD doing to keep this legislature informed about these significant changes?
I appreciate your remarks, and we have been very involved with families, and families have been very involved in the redesign process. I also understand their point of view that anytime services are going to change in any way, you're going to be nervous as to how is that going to look and how is it going to turn out. That's exactly why it's so important that we involve families in the design process, and they have been very involved. We've had a number of design teams that have helped with looking at how we can redesign the system for the future. Families have always been part of that. They're also members of our steering committee. And to make sure that we keep the public informed, we have various ways of communicating. We have a section of our website that is dedicated to monthly updates, to question and answers that we get that you may also be getting from individuals and families, to make sure that we're answering those questions in a timely way. We also hold video conferences almost every other month that are across the state, where we have various locations where families can sit in, as well as providers, so we can hear their questions, we can hear their concerns, and we can hear their ideas going forward. So we have had a very open means of communication. In fact, we were asked to present all that we had done related to our communications and involvement of families at a national conference last summer.
Communication is great, but if you're not taking the input and implementing it, you know, that's where the real problem occurs, I think.
Well, actually, I think families have been very important to the design. One of the most important things I think that they've provided input on is actually two things. One is the new introductions of an assessment tool that really assesses what their needs are. So we have a better handle on that. We've never done a great job asking that question. We've just provided a service, not really asking, does it meet your needs? Is there something different that you'd like to do? So the introduction of a new needs assessment tool that was guided by the input of individuals and families is an important step, as well as the introduction of new outcome measures in our system that look at, is an individual doing better because of our services? Not just are we providing the services, but what in fact does it mean for that person's life? And it was individuals and families who had the input and say as to what that new outcome system should look like.
The managed care organizations, the HMOs and the DISCOs that you're proposing, they'll be overseen by the Department of Health now. And it's my understanding that all rate settings in managed care administration will move from OPWDD to the DOH. But the DOH has little to no experience of managing programs that aren't based on a medical care model, whereas our service providers, along with the state, have partnered to create a system of providing a safe and healthy environment where individuals with developmental disabilities can grow, develop their full potential, and engage in meaningful community relationships based on a habilitation model. What are you going to do to ensure that these individuals with developmental disabilities will continue to be cared for based upon that habilitation model and not merely a medical model? And is that even possible when the DOH, with the DOH overseeing these changes?
Well, I agree with you that we have a very different model and that looks at habilitation. One of the things that we have built into the system design is the quality measures that I referenced that are not necessarily about, is a person going to be cured? Because if you have a developmental disability, you're likely going to have it for life. But that rather the outcomes are focused on, is the person happy in their life? Do they have choices? Do they have meaningful relationships? Do they have access to a home of their choice or activities during the day that are good for them? And I think that by having those outcome measures as part of the system, it really is better for the habilitative model.
And is DOH going to be able to do that without the experience that OPWDD has?
Well, we will have oversight of the DISCOs going forward. That will be a joint oversight. The Department of Health has more experience in the area of managed care, So in going forward, they will have expertise in that area, which we currently do not have expertise in. But we will have expertise in the areas of habilitation and understanding what it is that people with developmental disabilities need that is different than perhaps the population that they are used to overseeing.
I think that's important. You focus on the word managed care, because what this has the potential to turn into is a managed cost program, and that's not what we want to see. The families don't want to see that. They want to see a positive outcome with their children, and that is critical on a managed care level, and not simply a managed cost level.
Oh, I completely agree with your assessment that it's really about, are they getting the services that they need, and it can't always be about cost. But there's tremendous opportunity on the healthcare side to better manage the care for this population. People with developmental disabilities are more likely to end up in the emergency room. They're more likely to be in inpatient stays longer. They're less likely to see a primary care physician. So I do think that there's opportunities to better manage that side of their health care.
Okay. Just to take off quickly on what Senator Kennedy talked about as far as residential opportunities. Right now in Western New York, we have nearly 1,000 families on a waiting list for residential opportunities. About 420 of those need housing opportunities within the next 2 years. What is your plan to address this critical issue, and not just in Western New York, but over 15,000 people on the waiting list throughout the state?
Right. The waiting list is an issue that I arrived at when I took the position. And really what I would say is that it's a registration list. About half the people on that list will need services within the next 2 years. Half of them, it's longer than that. And we had never really assessed what are the needs of the people who are on that list. It's just a list that people sign up for. That's what we call it, a registration list. So what we have done is begin to look at what are the actual needs of the people on that list. Right now, about 90% of them are actually already getting services. So are those services meeting their needs? Do they need to be on the list anymore or not? And if we're not meeting their needs, what is it that they specifically need? So we've begun that process of evaluating who is on that registration list.
When you're talking about, parents who are 80-year-old parents who are taking care of 50-year-old children with severe disabilities, I mean, sure, they're receiving services, but they're not going to be there forever, much longer.
Right.
And what happens then? You get into an emergency situation where these children are ending up, these 50-year-old children, who are ending up in emergency rooms, in skilled nursing facilities, where the cost is way more than what we can really, what we should be doing.
That's why I think that the introduction of this model, the START model, the one that I mentioned, is very important because it's proactive. It's meant to prevent that type of situation that you describe. I think the needs assessment tool will also be important because you'll be really looking at what are the person's needs, what are the abilities of the family member to take care of that person or not take care of that person, should they get older, should the person's needs change, or should this living situation change.
Okay. Thank you very much. You have a tough job ahead of you.